increased cost has not been offset by improved productivity. We look to each other for answers that nobody seems to have. Even while many Americans have begun to look to a single-payer, government-controlled health system as an answer to the crisis in the United States, some governments with nationalized systems have recently introduced competing private insurance plans that offer their citizens a wider array of choices. And in developing countries, the notion of somehow replicating the systems of the developed world is simply unthinkable. Their only option seems to be adequate care for the rich and little for everyone else. The U.S. system's cost is fueled by a runaway reactor called fee-for-service reimbursement. It has taught us that the economist Jean-Baptiste Say was right, at least for this industry. When caregivers make more money by providing more care, supply creates its own demand. By some estimates, a staggering 50% of health care consumed seems to be driven by physician and hospital supply, not patient need or demand. Those fighting for reform have few weapons for systemic change. Most can only work on improving the cost and efficacy of their piece of the system. There are very few system architects among these forces that have the scope and power of a commanding general to reconfigure the elements of the system. Perhaps most discouraging of all, however, is that there is no credible map of the terrain ahead that reformers agree upon and trust. They are armed with data about the past, and they have become accustomed to reaching consensus for action when the data are conclusive. But because there are no data about the future, there is no map available to convincingly show these reformers which of the pathways ahead of them lead to a dead end and which constitute a promising road to reform. And few have a sense for the interconnectedness of these pathways. As the prophet of Proverbs said, "Where there is no vision, the people perish." So why this book? There is little dispute that we need a system that is competitive, responsive, and consumer-driven, with clear metrics of value per dollar being spent. Our hope is that the Innovator's prescription can provide a roadmap for those seeking innovation and reform, an accurate description of the terrain ahead, about which data are not yet available. Much of today's political dialogue on health care reform centers on how to pay for the cost of health care in the future. This book offers the other half of the equation: how to innovate to reduce costs and improve the quality and accessibility of care. We don't simply ask how we can afford health care. We show how to make it affordable, less costly, and of better quality. Almost every day somewhere in the United States, a group of healthcare reformers convenes a conference. We've attended many of these. Nearly without exception, the participants talk past each other. This one focuses on the uninsured poor, that one on prescription coverage for the elderly, another on overuse of expensive diagnostics technology, and still someone else on the cost of end-of-life care. Someone decries the perversions of fee-for-service reimbursement, while someone else bewails the failings of capitation. They talk past one another because they don't share a common language and a common understanding of the root causes of these problems. Unable to agree on the problem, and without a language for understanding one another, they find it impossible to articulate and agree upon promising solutions. We hope this book helps these reformers understand the root causes of America's health care malaise so they can frame solutions that staunch the problems at their source. And we hope to give them a common language so that we understand one another and can work cooperatively. The approach we take in the Innovator's prescription is unique. We have not studied health care to derive solutions for health care. Rather, our aim is to examine this industry through the lenses of general models of managing innovation that have emerged from 20 years of studying these problems at Harvard Business School and the Kennedy School of Government at Harvard. These models have been insightfully applied to industries as diverse as national defense, automobiles, financial services, telecommunications, computer hardware and software, public education, and steel. They have been used to help entire national economies remain competitive and prosperous. They have helped companies innovate in industries that are heavily regulated, as well as in those that are not. We use these models in this book first to explain the root causes for why health care has become progressively expensive